from the adult, the parent, to the child. There's a term called vertical transmission, meaning when we were born and when we lived with our parents, the bacteria that used to live in their mouth are transmitted to us through food, kissing, sharing. That's where we get the bugs from. So if we don't have parents with adequate oral health, oral care, and access to care and treatment, the child is vulnerable. They're living, picture someone who has a really bad cold, and you've got to sit next to them until you're 18 at least. You're going to get the treatment to stop getting the cold, but the parents are not. So you are living next to an infectious source. Those are some of the issues with policy. Policies where we will cover the child, we'll carry on a banner that says we are protecting children, and yet we are not taking care of the reservoir of the bacteria. We're not taking care of the reservoir of the disease. So it's very important that you folks bring back the message that oral health care for adults are important because we don't want to contaminate and infect children. The Surgeon General's report in 2000 on oral health gave us some pretty dismal ratings. 80% of dental disease falls upon 20% of the population. So 80% of cavities and all the other dental disease only fall upon 20% of the kids. These are the kids that are from poorer socioeconomic scenarios. We know that children with mass health or without insurance, they see the dentist less frequently. They have access to care less frequently. What does that mean, access to care? Well, it means that, little Timmy in some town has Medicare, has mass health, a government-sponsored dental insurance, and he needs to see the dentist. Well, he's going to go through the phone book. Well, mom's going to go through the phone book. And he's going to find out the majority of dentists don't want to see him. They don't want to take his insurance. That is in itself, not being able to find a dentist that would see you is discouraging. Okay? Mom's going to be like, well, we tried. We can't find them. So where do they go? Emergency rooms. But emergency rooms are not dental homes. As I brought up, the child's not familiar with the staff. They're not getting continuation of care, continuum of care. That is not being provided. So that is not the way to go. So access to care is certainly a barrier. Access to routine care is a barrier. If a child sees a dentist every 6 months, gets his cleaning, gets his fluoride, that's going to help prevent disease. The interaction alone, the interaction where information is being transferred between the doctor and the parents, like you folks are receiving this information right now, that has value. And that is not being done proportionately throughout society. Once again, 80-20. The state of Quincy, how are we doing here locally? As of July 1st, 2010, dental care for all mass health patients has pretty much been eliminated. Meaning that if you're an adult and you're over the age of 21, you have to make a decision if you have a cavity. The decision is as follows. Pay your rent or pay to get the cavity filled. And if you can't pay for the cavity to be filled, you can pull out a front tooth. Or you can just leave it. Let it get worse. And very often we have the same families, the adults with kids. These kids would get treatment, but the adults wouldn't. This disparity in access to care is a huge problem. Beyond that, since we're on the topic of treating kids, you folks are all familiar with, we have a little bit of a drug issue around here, opiate use. A lot of drug abusers, often teenagers, they develop something, methamphetamine users, they develop something called meth mouth. I wish I had a projector. I would show you what meth mouth looks like. It's probably not something you want to see after lunch. These kids, they started off with lesser access to care, and then they develop a drug habit. Their mouth gets decimated. And then You know, if they're on the verge of turning from 20 to 21, I consider anyone under 21 a kid, okay? They lose that insurance coverage. Now they have no teeth. How are they going to find a job? A lot of these kids try to get established in the service industry. They're in retail. When you have math and you have complete disasters in your oral health, it's very difficult for you to get a job. People judge you from the way you look. So, overall, oral health is not getting the aid that it should be in our nation. We're one of the wealthiest countries in the world. We certainly need the leaders in our community, all you folks, to remember that oral health care is a very important issue, and it's something that we should work on the prevention side, so we don't even have a problem. We should advocate for access, so that those in our communities, those who are marginalized and those who need this care most, can get access to this care. Dr. Sheffy is my partner at Lux Dental. He was my resident at the break. We decided to establish Lux Dental here in the community, and we are a national provider because we wanted to improve and alleviate the access to care. We have a practice at Cambridge now, and we're developing a practice just for children in Saugus, because the Saugus community serves Revere, serves Lynn, serves Saugus, Medford, Somerville, and we're trying to alleviate that. But practices alone are not going to solve this problem. This is a policy problem. So it's very, very important that when you meet your representative, or even in the back of your mind, you take oral health and place it in a position that's closer to your heart, because it's a very, very important issue, and oral health is part of it. So that's pretty much it. If you folks have any questions, since we're such a small group, feel free to ask me. I think Marilyn wanted to